Post-traumatic stress is a psychological reaction to an extremely stressful or traumatic event that deeply disrupts our sense of safety. It can be triggered by events such as being involved in a car accident, being the victim of a rape or an attack, experiencing physical or sexual abuse, surviving a disaster such as flood, bombing, or witnessing the death of a partner. What happens in our brain during a traumatic event? A traumatic event causes an intense activation of our defense mechanisms. The brain quickly shifts from a state of calm to one of extreme anxiety, and the primary emotions felt include fear, panic, and helplessness. In such moments, the story of your life may seem to unfold rapidly before your eyes, while your mind tries to cope with the situation. People diagnosed with PTSD face three major groups of problems or symptoms. One is reliving the traumatic event. This category includes frequent memories, nightmares, flashbacks that make the person feel as though they are re-experiencing the traumatic event. Memories are often triggered by sounds or images that remind the person of the event. Second is avoidance. Since recalling the traumatic event is extremely painful, people diagnosed with PTSD try to avoid thinking about the event. These individuals withdraw, avoid contact with places, people, and objects that could remind them of the event. They often feel numb or emotionally detached from others. Some people begin to consume alcohol or drugs to reduce the suffering they feel. Signs of physical stress is the third one, and they include problems with sleep, irritability or constant anger, difficulty concentrating or finding words, a sense of tension or alertness, and chronic fatigue. What causes PTSD? After confronting traumatic events, memories related to what happened are connected to what the person saw, smelled, or felt at the time. Later, similar images, sounds, smells, or emotion can trigger a flood of memories and emotions. A second reason for the persistence of these emotions is that the traumatized individuals need to explain what happened to find meaning. Confronting traumatic events leads the person to question their previous beliefs. For example, they may begin to doubt that the world is a safe place or that nothing bad will happen to them. To understand the trauma, these people often think about what happened and its implications. However, as they think about it, they will recall what happened and relive the same emotional states. As a result, instead of reaching understanding and peace, they oscillate between recalling the event and trying to forget it. How does PTSD develop? Many people experience specific symptoms shortly after encountering the traumatic event. They undergo acute stress symptoms such as sleep disturbances, reliving the trauma, and intense anxiety. Approximately half of these people will find that the symptoms resolve on their own about after 3 months. In others, the symptoms may persist longer, even for years, leading to chronic stress. There are also people who only develop symptoms many years after the traumatic event. Long-term problems include a loss of self-confidence, social isolation, and depression. What is the connection between pain and PTSD? Studies indicate that the pain and PTSD are comorbid. People with chronic pain have higher rates of PTSD, and similarly, those diagnosed with PTSD often have chronic pain conditions. More than 30% of people seeking out patient treatment for PTSD and between 50 to 80% of former military combatants or firefighters suffering from PTSD report chronic pain. PTSD has been identified as a risk factor for chronic pain, for the progression from acute pain to chronic pain, and for pain-related disability. Moreover, chronic pain is an indicator for the development of PTSD, and the components of PTSD appear to maintain and intensify pain symptoms and vice versa. Why is it important to seek help quickly? Rapid intervention is essential to reduce the impact of post-traumatic stress. Specialists recommend seeking help within 72 hours of the event. During this period, the brain is still in the process of integrating the trauma, and adequate support can prevent chronicity of the symptoms. How are trauma integrated into our lives? When we experience trauma, to feel safe again, we need more than logic and reasoning. Why? Because trauma remains trapped in the body, and it is often from here that we must begin healing. Trauma impacts our nervous system at deep level, leaving the body in a state of hypervigilance. And even if we rationally understand that we are now safe, our nervous system can still react as if it is in danger. This happens because memories of trauma are not stored in the same part of the brain as the logical thoughts. They are stored in body memory and parts of the brain that process emotions, sensations, and survival. These parts of the brain, like the amygdala, becomes highly activated by traumatic situation, imprinting intense emotional and physical responses to certain triggers. As a result, trauma can resurface as bodily sensations, emotional reactions, or stress responses, even when there is no immediate danger, making it quite challenging to break out of the state. To access a sense of safety, it is important to work with the body and the nervous system, not just with our minds. Techniques that engage the body and senses can calm the nervous system and gradually build a sense of safety. Healing is not about convincing yourself that you are safe. It is important to teach our nervous system, through consistent and gentle practices, that we are safe to rest, connect, breathe, and feel whole again. Treating PTSD often requires a combination of approaches. Psychotherapy with cognitive behavioral therapy, EMDR, which stands for eye movement desensitization and reprocessing, somatic and integrative therapy, body-centered therapies that are extremely effective, allowing the processing of trauma at various levels of depth. Also medications, in some cases antidepressants or anxiolytics, may be used, but only under the recommendation of a doctor. Relaxation techniques such as meditation, yoga, or guided breathing techniques can reduce stress and anxiety. In conclusion, healing is possible. Post-traumatic stress may seem overwhelming, but with proper help and time, healing is possible. It is important to seek support, be patient with ourselves, and recognize every small step toward recovery counts.